Greetings all. We are going to be discussing pediatric urinary disorders. This is phimosis, the inability to retract the skin, foreskin, covering the glans penis. It may appear as a tight ring or rubber band of foreskin around the tip of the penis. This is just something that can obstruct the flow of urine, resulting in dripping. Various treatment options. A lot of times the doctors will just kind of wait to see if it resolves on its own. They will recommend and prescribe steroid cream, which just helps stretch that foreskin, or you can have it surgically or partially removed, which would be a circumcision. Hydrocele, this is swelling in the scrotum due to fluid in the thin sheath surrounding the testicles, if you look at the picture here. Hydrocele is common in newborns. Usually it disappears without treatment by age 1. It's the most common cause of painless scrotal swelling in the children. Sometimes the fluid will remain after the sac closes, which is just called a non-communicating hydrocele. The fluid is usually absorbed gradually within the first year of life. Occasionally, though, the sac remains open, which is called a communicating hydrocele. The sac can change size, or if the scrotal sac is compressed, fluid can flow back into the abdomen. Communicating hydroceles are often associated with inguinal hernias. May require surgical treatment. After surgery, straddle toys are avoided for 2 to 4 weeks. That way you don't increase the chance of trauma. So this is a condition where one or both of the testicles fail to move from the abdomen where they develop before birth. So they start in the abdominal cavity, they move down to the inguinal canal, and then they fall into the scrotal area. If a doctor cannot feel the undescended testicles, it is unpalpable. It may be in the abdominal area. This is the least common location for an undescended testicle in the abdomen. In the inguinal, so sorry, it's early, guys. The testicle has moved into the canal, but not far enough to be detectable by touch. The goal of treatment is to move the undescended testicle to its proper location in the scrotum. Treatment before 1 year of age might lower the risk of complications, such as infertility or testicular cancer. Earlier is better, but it is recommended that surgery take place before the child is 18 months old. The surgeon carefully manipulates the testicle into the scrotum and stitches it into place. That surgery can be done laparoscopically or open surgery. Fertility for males after surgery with a single undescended testicle is nearly normal, but falls to 65% in men with 2 undescended testicles. Surgery might reduce the risk of testicular cancer, but does not eliminate it. This is an opening of the urethra on the underside of the penis instead of the tip. Treatment is always surgery. It is a birth defect. It is one of the most common congenital abnormalities, 1 in 300 live births. In most cases, the opening of the urethra is within the head of the penis, left often Less often, the opening is at the middle or the base of the penis. Rarely, the opening is in or beneath the scrotum. Treatment is surgical correction, which it will enhance the child's ability to void in standing position with a straight stream, improve physical appearance, and preserve sexual adequate organ. Some forms are very minor and do not require surgery. However, treatment usually involves surgery to reposition the urethral opening and, if necessary, straighten the shaft of the penis. So, this is a rare congenital defect in which the bladder extrudes through the lower abdominal wall. It occurs 1 in 40,000 newborns, more common in boys. Let's see, it's just caused from a failure of the abdominal wall to close. It can cause upper urinary tract infections. Usually the upper urinary tract, testes, and ovaries are all normal. It appears as a mass or bright red tissue. Urine continuously leaks from the open urethra. Females have a bivid clitoris, males a short stubby penis, and the glans is usually flattened. There is no known cause for this. The problem occurs 4 to 8 weeks after a woman becomes pregnant. This is when organs and tissues begin to form and specifically develop. Exotrophy is not caused by something the mother did or did not do. Since the bladder is inside out and open, it does not hold or store urine. Let's see. Surgery is going to be the treatment plan. They're just going to repair the exotrophy. Let's see. Complete primary repair for classic bladder. They just close that exotrophy. It's just a primary bladder closure. Urethroplasty and genital reconstruction are performed in a single stage in newborns. And then you're going to provide that good patient teaching on signs and symptoms of infection, diet recommendations per doctor orders. Patients with classic bladder exotrophy may also have early difficulties feeding because of the body's position and traction. So just make sure you're providing that good patient education and answering any questions, because it can be very scary to the parents. Disorders of sex development. A mismatch between a child's chromosome or genetic material, or even the appearance of the child's genitals. This can occur in infancy, childhood, or adolescence. Ooh. Oh, sorry. The most common cause is congenital adrenal hyperplasia, which is an emergency. Treatment depends on the underlying cause. Usually you're going to have surgery. They're going to be put on hormone therapy. Normal sex differentiation occurs at 7 weeks gestation. The most common cause of this, like I said, is the CAH. Can lead to salt wasting, adrenal insufficiency, and is life-threatening. Fluid and electrolytes must be replaced quickly. Medical therapy for disorders of sex development depends on the underlying cause and and is indicated for the conditions associated with ambiguous genitalia, including congenital adrenal hyperplasia. Supplemental hormone therapy may be implemented if gonad function is compromised. Ambiguous or abnormal genitalia may be indeterminate phenotypical sex related. So all that means is there is a mismatch in the child's chromosome and or genetic material. So the appearance of their child's genitals will be off. And I will make sure to put some extra resources on that, explaining it further with a picture if I can find one that is appropriate. I will make sure and add that, because that can be very confusing. There remains a lot of controversy surrounding the treatment of DSD. No one debates the needs to address and treat underlying physiological problems such as associated with CAH. The controversy primarily revolves around issues of gender reassignment. Gender assignment by the physician and family may not correlate with gender preference by the patient in adulthood. So there is a lot of controversy with changing the appearance of the genitalia. Hemolytic uremic syndrome. This affects the blood and blood vessels. It is a result in the destruction of blood platelets, anemia, and kidney failure due to damage to the very small blood vessels of the kidneys. It is an uncommon renal illness that occurs in children 6 months to 5 years. It is, however, the most common cause of acute renal failure in early childhood. Let's see. Predominantly in whites. It's prevalent in South America, Argentina, West Coast, North and South America. The diagnosis goes by diarrhea positive HUS in 90% of the cases. It's caused by E. coli. Can get from not cleaning surfaces of cabinets when preparing food such as chicken, turkey, and hamburger. Drinking or swimming in contaminated water. Diarrhea negative or atypical AUS can be due to non-enteric infection, disturbing malignancies, and genetic disorders. So you just need to know that some of the signs will be bloody diarrhea, abdominal pain, pale skin, irritability, fatigue, fever, easily bruised, and decreased urination. There will be, if a doctor orders an urinalysis, there will be proteinuria present. They will monitor the BUN and creatinine. And then it is very important to do a stool sample to monitor for E. coli. The patient will get intravenous fluids. They will monitor anemia. Temporary dialysis may be necessary to treat the acute kidney failure. And then you're going to monitor I's and O's and provide patient education, especially on fully cooking meats and avoiding unpasteurized juices. The end. I know that was a lot, guys. Some of these disorders are really hard to explain, but I will have extra resources for you guys to look at. If you have any questions, if I've misspoken or confused you in any way, please don't hesitate to email. Thank you.